Though everyone is born with a butterfly-shaped gland in the neck, many don't realize what its role is and how the thyroid can affect everything from metabolism to helping regulate the heart, nervous system, even menstruation. Well, January is Thyroid Awareness Month, and the American Thyroid Association says that many people are unaware they may be affected by issues. So today we welcome Dr. Jeff Janus, chair of ENT at Mayo Clinic, to talk with us about thyroid concerns, which actually affect 1 in every 10 people. So good morning. Thank you for being here with us.
Good morning. Thanks for having me.
Absolutely. This is such an important topic. So let's just start with a simple question. What is the thyroid and its function?
Sure, and that's a great question. That's a great place to start for a lot of these concerns. As you mentioned briefly in your intro, the thyroid is a butterfly-shaped gland that sits in front of the trachea, sort of where my tie is. It sits low in the neck, right in the front. And the thyroid has one main function. It's to sort of regulate metabolic activity in your body, and so. The thyroid secretes hormones that regulate everything from your level of energy to your heart rate to digestion, weight, mental acuity, skin, hair. It really has a lot of functions for such a small organ.
Wow. And can you share some of the symptoms of issues that people may begin to notice that could possibly indicate some thyroid concerns?
Yeah, absolutely. So, as an otolaryngologist or an ENT surgeon, the main thing that I treat is thyroid cancer or thyroid nodules that need to be removed from the body, and we work with our endocrinologists here to sort of help a lot of these other thyroid diseases or thyroid disease like hyperthyroidism or hypothyroidism. When you think about what we treat as a specialty group here where I work at Mayo Clinic. Things like hyperthyroidism and hypothyroidism that are treated mostly by our endocrinology group are, basically manifested by things that you would think that influence things like your heart rate, digestion, metabolism. So hyperthyroidism, for example, you can see things like losing weight without trying, faster heartbeat, irregular heartbeats, nervousness, tremulousness, tremor, stuff like that. Thyroid cancer is a little bit different. That typically presents as a painless nodule in the thyroid gland. And typically we work with our endocrinologists to accurately diagnose and treat these. And surgeons really come in when part or all of the gland needs to come out.
And I'm curious if you have an issue, with your thyroid, could that increase your risk of getting thyroid cancer?
Not necessarily. Typically you can think of risk factors for getting thyroid cancer as who typically gets thyroid cancer and is there a reason why they get it, right? So when you think about who typically gets thyroid cancer, we know that women are essentially at 3 times the risk for getting thyroid cancer when compared to men. Women typically get cancer in their 40s and 50s, thyroid cancer in their 40s and 50s, and men are more typically affected in their 60s and 70s. There are some risk factors for thyroid cancer that don't necessarily include thyroid disease. This includes things like radiation exposure. Way back when, things like acne in children were treated with radiation to the head and neck, believe it or not. And so folks that have had high doses of radiation to their thyroid are at increased risk for cancer. Low iodine in the diet, which we don't see as much of anymore because of things like iodinated salt. And then certain genetic syndromes, right? So there are things like, familial medullary thyroid cancer and multiple endocrine neoplasia and Cowden syndrome and familial adenomatous polyposis. There are all these syndromes that have kind of these funny names that put people at increased risk. And that's kind of why it's important when you're diagnosed with thyroid cancer to visit with somebody who specializes in the disease to kind of rule some of these things out and make sure that you and your family members aren't at risk. But typically, yeah, we see it in women more than men and in 40s and 50s for that presentation.
Absolutely. Such an important topic. Thank you so much, Dr. Jeff Janus. It was a pleasure having you on this morning.
Thank you. Have a great day.
You too.